Hi, this is Kyla. I am a first-year nursing student and I'll be assessing the abdomen in this video. So an assessment of the abdomen can provide diagnostic use of the gastrointestinal and genitourinary pathologies and to those who give insight regarding abnormalities among other organ systems. So the first thing that we need to do is to check the patient's medical records to determine the scope of assessment needed so that I can prepare the necessary materials prior to meeting the client. So the first thing that I need is the measuring tape, the stethoscope for auscultating abdominal sounds, and a pen to mark. Now that I'm done preparing these materials, I'll be washing my hands before meeting the client. Hello ma'am, good day. I am Kyla. I am your student nurse for today. May I know your full name please? And your birthday ma'am? Okay, so how old are you? Okay, so what do you want me to call you ma'am? Okay, so Miss Anne, I'll be with you for your abdominal assessment for today. And with that, I will be exposing your abdomen part of your body so that I will be able to inspect, auscultate, percuss, and palpate. Would that be okay with you, ma'am?
Yes.
Okay, so do you have any questions or clarifications before we start our assessment?
No.
Alright, so rest assured that all of the information that we've gathered will be kept confidential. And also, provide privacy to the patient and adjust the temperature for the client's comfort. So first thing, I need you to void or urinate first to eliminate bladder distension that might interfere the abdominal assessment. Okay, thank you, Miss Anne, for cooperating. I will now assess you to a supine position. This will allow your abdominal muscle to relax. Alright, so for the first part of the assessment, I will only be observing your abdomen. So can I lift your shirt for now?
Yes.
Alright, so I can see that there are no visible vascularity that might indicate circulatory issues. You haven't had any stretch mark either, and your abdomen is free of scars, lesions, and rashes as well. Now I'm going to inspect your umbilicus for its color, contour, and locations as well if it's deviated. Alright? Alright, so your umbilical skin tones are equal to surrounding abdomen, and it's round and also it is not deflated from the sunburn. Alright, so for the next part of the assessment, I'll be inspecting for your abdominal contour on the profile line from the red margin to the pubic. Okay, so I want you to take a deep breath, then hold it in. This will make an enlarged liver or skin more obvious. Alright, take a deep breath. Okay, so abdomen is abdomen is flat and there is no evidence of enlarged liver or spleen. Alright, so now that we've emptied your bladder earlier, I will be measuring your abdominal girth on the circumference around your belly button. So I'll mark your belly button to make sure that it is measured in the same location for the next assessment. Okay? Alright, so I'll be inserting the measuring tape under. Alright, so it is 63 centimeters. So I'll be documenting it. This time I'll be moving towards your foot to check if your abdomen is symmetric. Alright, so abdomen is symmetric and in a relaxed position. So this time, can you raise your head for me? Alright, so no bulging as well. That might indicate diastasis movements caused by respiration and symmetric as well. And no peristaltic waves that are observed. Okay, so now I'll be auscultating for your abdomen this time. So first, for your vowel sound, I'll be using my stethoscope to auscultate for it. And don't worry, I already checked the temperature and it's already warm. So I'll just be first cleaning this one. Alright, so I'll be using the diaphragm of my stethoscope to assess for the high pitch sound. So first, on your right lower quadrant, and then to your right upper quadrant, then to your left left upper quadrant, and then lastly to your left lower quadrant. Alright, so I heard rolling sound on your stomach, and it is normal since our abdomen makes a gurgling sound at the rate of 5 to 30 per minute. Alright, so now I'll be switching to the bell of my stethoscope to auscultate for the low-pitched vascular sound. So first on your aorta, and then next for the renal artery, next for the iliac artery, then to your femoral artery. Alright, so I haven't heard for any broad sound or murmur, which is normal. Alright, this time I'll be auscultating our epigastric and umbilical regions for the venous hum, which is not normally heard in this area. So venous hum might indicate a hypertension. So first for your epigastric, then on your umbilical region. Alright, so I haven't heard any whining noise or venous hum. Alright, so for the last part of the auscultation, I'll check for the friction rub over the spleen and the liver using the diaphragm of my stethoscope. Okay, so I'll be checking for the lower rib cage from left and right, alright? Alright, so no friction rub is heard. That might indicate infection. Alright, so for the next part of the assessment, I'll be percussing your abdomen for the resonance sounds. Alright, so I'll start from the right lower quadrant. Moving to onto the upper quadrants. Alright, so for the next assessment, we'll be assessing for the span or height of your liver. So I need to determine the lower and upper border first. Okay, so for me to determine the lower border, I'll start at the right lower quadrant along the mid-clavicular line. And then I will be percussing the upwards until there is a change from the tympani to dullness. Alright, so I'll start now. Alright, so I'll be marking it. This will be your lower border. Okay, so this time I want you to take a deep breath and then hold it in. Alright? So inhale and then hold it. So I'll be percussing downwards from the dullness earlier. Lower border of the dullness. Alright, I'll mark it. This is the dozen of your liver. Alright, so to determine the upper border, I'll be percussing from the upper right chest along the mid-clavicular line. And I'll be starting from the nipple area. Okay, so I'll be marking it. This time, this will be the upper border of your liver. So I'll be repeating the percussion of the liver, this time along the mid-sternal line or in the center of your body. Alright? Alright, so I'll mark this lower border of the nest of your liver. So now, I'll start from the top for the upper border. So I'll mark the lower border of dullness of your liver. So I'll be marking it. So now that we've done the upper border and lower border of your liver, I'll be measuring it now. Next, I'll be percussing this time for your spleen. So for percussing the spleen, I'll start from the posterior to the left splenic of your line at your side. So I'll be moving downwards until I feel the change from long resonance to splenic dullness. Alright? Okay, so another method of percussing the spleen is to start from the mid-axillary line. Alright, so when percussing your spleen, my observation indicates that there is no sign of enlargement of spleen. Alright, so for the next part, I'm going to do a blunt percussion. So to assess for the tenderness, starting with your liver. So I'll assess you now to a sitting position. Alright, so I'm going to strike your lower rib cage using my ulnar surface of my fist. So tell me if you feel any pain, okay? Do you feel any pain? No. Okay, so now I'll move to your back. So I'll be doing the same thing at your back for blunt percussion of your kidneys. So I'll strike using the ulnar surface of my hand and then just tell me if you feel anything, okay? Do you feel any pain? No. Alright, so there is no pain and tenderness found. So I'll assess you now to a spine position. So there is no pain and tenderness found in the place of fit of your kidneys. This time, I'll be testing for your abdominal distension, bulging flaps, or ascites. So I'll be percussing across your flanks until there is a change for dullness and tympany. So I'll be marking that point as well. Alright, so for ascites, let me assess you to a sideline position. Now I'll be doing the same thing again. Alright, so you can relax now. Alright, so there are no bulging fluts and ascites that might indicate liver damage. Alright, so for the last one, for percussion, I'll be performing a fluid wave test. So I need you to place the edge of your hand firmly down the midline of your abdomen. Alright, like that. Now I'll be placing one of my hand at the side of your abdomen and the other one will be tapping your abdomen wall. So I'll just be tapping your abdomen wall. Alright, so there is no fluid wave that might indicate ascites. Okay, now I'll be performing a light palpation to assess for the tenderness and cording. So I'll start from the right lower quadrant. So I'll palpate for at least 1 centimeter deep. Then I'll be moving to another quadrant. Alright. Okay, so this time I'll be performing the palpation. So I'll be doing it deeply. So please tell me if you feel anything, alright? Okay, so this is to evaluate versatile masses. And if I find any resistance, I might have used bimanual deep palpations using both of my hands to palpate deeper. But for this case, no severe tenderness and pain that might relate to trauma. Now I'll be compressing for all 4 quadrants to assess for masses. Alright, so there are no detected masses that I should be noting as well. This time, I'll be palpating for your umbilicus for swelling, bulges, or masses. Okay, so center is not too soft for potential irritation, and there are no hand nodules. So this time, I'll be palpating for the aorta to assess for the positions of abdominal aorta. Alright, so tenderness is mild and moderately strong but regular pulses. Next is I'll be palpating for your liver to assess for consistency and tenderness that might indicate vascular engorgement or tumor. So I'll be placing my left hand at the 11th and 12th ribs and the other hand pointing towards your head. Alright, so I want you to inhale and I'll be pushing my fingers upward, then relax. Alright, so the lower edge of your liver, smooth and even. No tenderness also is found. Next is I'll be palpating for hooking. I'll be curling my fingers like a hook to assess for enlargement of the liver. So I want you to take a deep breath. I'll hook at the liver area. Alright. Okay, then relax. Alright, so no tenderness and found that might indicate hepatitis and other liver diseases. So next is I'll be testing for the cholecystitis or the inflammation of the gallbladder. So I'll be palpating for your muscle margin and I want you to take a deep breath and let me know if you feel anything or if you feel any pain, okay? Okay, so take a deep breath. Inhale. Okay, so you can relax now. Okay, so there are no pain and tenderness as found. Now I will assess you to a sideline position. Next is I'll be palpating of your spleen. So I'll be doing the second method of palpating by moving my hands downwards and forward. So let me know if you feel any pain, alright? Okay, so spleen is non-palpable and no pain as well. And no tenderness is found that might indicate enlargement of the spleen. Okay, so you can relax now. Next is I'll be palpating for your kidneys. So I'll be placing my left hand at the back to provide support and my other hand at the costal margin and I want you to inhale. Okay, exhale. I'll gradually removing my fingers. Alright, so I'll be doing the same thing on the other side. So I'll be providing support using my right hand and then inhale and then exhale. So do you feel any pain? Alright, so no pain is found and kidneys are palpable and no indication of enlargement and no tenderness found. Next is for hypersensitivity test. So I'll be using a broken cotton tip as a short object to stroke your abdomen. Okay, so let me know if you feel any pain, okay? Do you feel any pain? Alright, so no pain and no exaggerated sensation are found that may indicate appendicitis. Next is I'll be assessing for the SOA sign. So to assess for SOA sign, let me assess you to a sideline position. Okay, so I'll be extending your leg and let me know if you feel any pain, alright? Do you feel any pain? No. Alright. Okay, so there is no pain present that may indicate irritation of the ellipsoas muscle or inflamed appendix. So, okay, so let me assess you to a supine position to assess for the obturator sign. So, this time I'll be flexing your hip and knee as well as your leg internally and externally. So, let me know if you feel any pain, alright? Do you feel any pain? No. Alright, so There is no pain is present that may indicate of the obturator muscle or perforated appendix. So lastly is I'll be testing for the appendicitis. So I'll be assessing for your rebound tenderness by palpating on your appendix at the 90-degree angle. Okay, so I'll be releasing it now. Okay, so may I ask you if which hurt more when I press it or when I release it? I didn't feel it. Okay, so there is no abdominal pain and no rebound tenderness is found in your appendix. Alright, so Miss Anne, we're almost done now. I'll be summarizing all the findings earlier. So upon inspecting your abdomen, there are no presence of dilated venous observed and no stretch mark, no lesions, and any rashes. And there are no scars observed as well. So also, your skin tone seems no abnormal and your abdominal movements are symmetric. So upon auscultating your abdomen, I also observed series of contentment flex and gurgles, which is normal. There are no brute or low pitched murmur like sounds or heard upon auscultation of your abdominal aorta, your renal, your iliac, and your femoral arteries, which is a good thing. Also, there are no venous and there is no friction rub over the liver or spleen was observed, which is considered to be normal. And also, upon percussing your abdomen, I observed that your vertical liver is at 10 centimeter, which is within normal range. Furthermore, lower border of the liver dullness, this is from 6 cm below your costal margin, which is also in the normal range. Also, upon percussing your spleen, I observed that the area of dullness of your spleen is about 7 cm near your left 10th rib or as likely to see your mid-axillary line. And the psoas sign and obturator are all negative. There are no presence of rebound and tenderness. Alright, so all in all findings are normal. Alright, so all in all, findings are normal. So thank you, Miss Anne. You have been a wonderful patient. Thank you for your cooperation and see you around.